So who are you and what do you do?
Hi, my name is Hussain Gandhi. I'm a GP in Nottingham City practice called Wellspring Surgery. I'm also a clinical director of the Nottingham City's primary care network, and I also run a platform called eGP Learning, which is designed to tech enhance primary care and learning.
And am I right in thinking you've got another name that people are familiar with on social media?
Yeah, so on social media, I'm nicknamed Dr. Gandalf, which has been a moniker I've had for about 10 plus years now. And yeah, on a variety of social media platforms and other places as well.
You're obviously an early adopter of tech, which is not true of all GPs. Tell us a bit about your tech history then.
So I think me and tech probably started when I was starting in GP training. I was always frustrated about trying to share information with patients and how difficult it was to do that. We're very reliant on printing off stuff and things for patients. So I created a website simply as like a dashboard to give me quick access to things like patient information leaflets, that kind of stuff that I could then share with patients. So I could send them the links and that kind of stuff. But that was a bit tricky to do initially. But with some of the tech changes we've now had, that's so much easier. Things like Accurix and other platforms that allow us to do that just made life so much better. But then because of that wanting to share information with patients, I kind of developed that to try and help clinicians use tech better. And that's where eGP Learning started. And over that time, it's gone from being a website to a podcast to a vlog, which has now grown over the past couple of years to be hopefully quite productive and effective.
When you started doing this, did you feel that you were sort of a tiny minority, that a lot of GPs were quite tech resistant?
I think most GPs are happy to use tech, but the challenge they've got is changing what they're doing is the biggest barrier, because often tech is designed to be very secular. It's not designed in primary care to be all-encompassing and to allow everything to work effectively. Because of the kind of ethos that many people have used with tech, it tends to only help in different parts, and then that makes the overall job potentially a bit more trickier. So I think as time's progressed, we're hopefully seeing less of that. But generally speaking, most GPs don't have a huge problem with using tech as long as it doesn't make their life more difficult, which unfortunately it normally has had a habit of doing that up until more recently.
I think more tech savvy patients have been pretty frustrated until recently. Yeah. I speak from personal experience about how difficult it is to communicate with a GP surgery via modern methods.
Yeah,
very resistant to email, for example.
Yeah, I think part of the challenge there is that, unfortunately, consumer level tech is completely different to what we are allowed to use in the healthcare system because of added governance and security and challenges that come with having it all approved. And, particularly with the liability that's left with many clinicians, if they use the wrong kind of tech, then that can be a real challenge. So often I get patients saying, well, why can't you just WhatsApp me? Well, unfortunately, WhatsApp is not a platform that's suitable for patient level communication. Point blank. So, it's not even a platform we're allowed to even entertain using. And that's confusing to many patients because they're just like, well, I can do it. I'm giving you permission to do it. Why can't you just do it? And the answer is we're not allowed. So that's often where a lot of the challenges, I think, come in terms of consumer tech is completely different to healthcare tech.
Isn't that something that's changed in a lot of areas apart from health? And health needs to think about whether it should be a bit more tolerant of consumer tech.
I think it should be. I definitely agree with you. It'd be so much nicer if we could use a lot of the consumer level things, because consumer tech innovates so much faster than healthcare tech, in my perspective. But again, it's that liability issue that keeps coming into play with it, which is where the frustrations and the challenges lie for many people using the tech. Because who holds that liability? And I think it's very easy for many of us to say, well, it doesn't matter. But when there are things like data leaks, when there are issues with the way that consumer tech can sometimes not have the same security levels or issues, that's the part people forget about, and I think that's where the challenge lies with it.
So nearly 2 years ago, the pandemic came along, March 2020. How well were you prepared in your practice for confronting that challenge from a technology point of view?
I think we probably didn't have as far to go as many other places. We had always used remote methods of communication with our patients even before COVID hit. So predominantly a lot of our work was done over the telephone with our patients before COVID came along anyway. So for us, it wasn't a huge change. Adding in online consultations was something that we were a bit more hesitant across the practice with doing. But gradually we've started to adopt that over the past couple of years, like many practices have. I know there are definitely some practices that have really found the change to using remote methods first really difficult, because it's not only the tech that fuels it, but it's also the way that you use that tech and stuff to make it effective and things that's a little bit more challenging as well.
Well, take us through that. What are the challenges in suddenly telling people that they're going to not just turn up at the surgery, they're going to be phoned or video called?
I think it's partly the expectation. So there's been that element of, well, I've always done it this way, why can't I do it that way? And clearly the height of and start of the pandemic, many people understood the elements of infection control. As we move forward, we're now 2 years post-COVID kicking off. A lot of people still are struggling with the reason, well, I can go out to the shop and it's not a problem. Why can't I just come down to my GP? But again, it comes down to that liability and that risk element of things that actually, we have a responsibility in general practice to protect all of our patients, not just the patient sitting in front of us. And what if, by coming into the reception area, you've accidentally then infect somebody who's 80 plus with lots of other health issues, and then leads to them having, unfortunately, a really negative outcome. That liability lies with the practice, and our responsibility to protect the population, not just the patients.
So how does it work? What is the technology that you are using to manage patient appointments?
So I think there's different levels and different places do different things. We predominantly use telephone-based contact for our patients because, particularly with the area I work in, actually not as many people use online methods like email and that kind of stuff for their healthcare routes. They prefer being able to speak to somebody, and that's where actually telephone is a really good technology. You can convey quite a lot of information fairly quickly, and most people know how to use a telephone. So it's about the tech that most people can use. You compare that to something like video consultations, which a lot of people seem to think was always going to be the panacea of healthcare, that you can deliver video-based healthcare from anywhere, and it's really easy to do. And actually, that's not as simple as people thought. So you need to have the infrastructure, you need to have the right equipment, you need to have the right systems to enable that to happen. And actually, I think we found that, and the evidence is there, that even now we're 2 years into the pandemic, video consultations is still not the main route of care that many people thought it would be.
That's interesting, isn't it? Well, there was an awful lot of hype around video calls. There were notable companies, even long before the pandemic, advertising the possibility of video consultations, and it was the future. Why is it not taken off as quickly as people expected?
Well, I think there's a couple of elements to that. So one of the reasons why people thought it was always going to be effective is the convenience element of video. So not only do you get to speak to somebody, but you get to see them at the same time. And there is definitely that element of being able to see someone that has a better, connection and able to have a better rapport with the clinicians. And we know that if you've got a good rapport, trust with your, clinicians, you're more likely to have a positive consultation and a positive outcome because you're more able to share information. But I think the reason why it's probably not worked as well is a few different points. So number one, as I mentioned earlier, was infrastructure. When you open that up to a mass market, everybody needs to have decent, internet access and decent devices that allows them to have a good video consultation. And actually, if you're in built up city areas without Wi-Fi, that may not happen. You may not have the cellular connection because not everybody's got 5G, for example. Not a lot of people don't even have 4G, for example. So how is that going to work when you don't have the data connections to allow that to work effectively? A lot of practices don't actually have the internet capacity to even do video consultations. So particularly look at rural practices, many of them probably don't have the bandwidth to allow video consultations to be a routine part of their care. The other thing to remember is that whilst videos allow you to see the patient, there's a limit to what you can still do just by visually seeing something. So whilst you may be able to identify where the patients are telling you the problem is a lot better because they can point to it or they can share it, you still can't feel certain things, for example. So you can't feel a lump, just by looking at it through a video consultation. You can't listen to a chest, although you can pick up other things. So you can obviously see how quickly a patient's breathing. You can see if they're breathing in discomfort, but there's still a limit to what you can do. So whilst there are gains from having a video consultation, it probably isn't as much as people thought. And it only works if you've got another system to put patients into. So for those that then do need a face-to-face consultation, you still need the method to then put them into a face-to-face consultation effectively. And that's probably where COVID's been a bit more challenging because it's obviously a capacity issue that comes into play there.
So your main tool has been, frankly, a telephone call.
Yeah.
That's how most of your consultations happen.
Mhm.
How many people do actually end up though with a face-to-face consultation? Is that completely, uh, off the agenda?
It's not off the agenda. General practice, in particular, has never been shut. There have been absolutely, as the evidence shows, there has been a reduction in the number of face-to-face consultations. I think that's partly because there's been patients not wanting to come in, probably in the minority, but there definitely are patients who don't want to come to the practice, whatever reason that may be, whether that's down to convenience or whether that's down to because they don't want to expose themselves. I think there is also the capacity element that if you've got clinicians, trying to deliver effective remote care, that therefore means you've got less people available to deliver face-to-face care. And because of infection control, face-to-face care now takes longer. Before we see a patient, we have to make sure we're wearing the right PPE. We have to clean down the rooms. So that means you've got less time to actually see patients with compared to before where, actually there was less of a consideration, pre-COVID and stuff. So I think, when you bring into account capacity and all the other kind of things, yes, there's less availability of face-to-face, but that doesn't mean that we don't see patients face-to-face. I was in clinic yesterday and I saw 10 patients face-to-face, on top of doing about 30 telephone calls and a variety of other admin stuff. And that was my, day effectively.
How have patients reacted over the last couple of years then to this new system?
I think there's been positives and negatives. I think there definitely have been patients that have appreciated the convenience and the effectiveness that remote care can sometimes offer. Not having to take half your day off just to come down to the GP practice to get a prescription, for example. Those are consultations I used to have pre-COVID, and even before we went to telephone triage methods and stuff in our practice. And that's a really frustrating waste of time. And I am going to use the term waste because it's not a great use of my clinical time just to see someone to give them a prescription. And it's not a great use of the patient's time because they've taken time out of their day to come and see me just to get a piece of paper. Okay. I think there are definitely patients where remote doesn't work, and it's important to recognize that the remote doesn't work for everybody. Patients, for example, with learning disabilities, patients who don't speak English as their first language, and those patients with mental health issues or other kind of health challenges that mean that actually, telephone is more difficult for them. But at the flip side, we've also had many patients where telephone is a really effective use of care. There are many instances where I've had patients who, with mental health issues, have found it really difficult to open up to a person who's in front of them. But over the phone, they feel more comfortable doing that and easier for them to access healthcare. So there are winners and losers. There's always going to be that when you have a change in the way that you deliver things. I think on balance, it's trying to find out what works best for as many people as possible, because you will never have a system that works for everybody.
So will you ever go back to the status quo before the pandemic? Will it become normal again to go to your GP?
I think it will probably and hopefully end up going back to a system where, yes, it's easier to see your GP. I think many practices will probably still stick to the method of having some form of remote contact first, just because it can be so much more effective in terms of delivering healthcare, and particularly when you're trying to deliver healthcare on a shoestring budget and you don't have the capacity to say, come in and see us, without any filtering. Because actually one of the other things we now realize is that seeing your GP is not always the best option for your healthcare. If you need a medication review, let's be honest, seeing a GP for a medication review is probably not the best option. Seeing a pharmacist who knows so much more about the medications themselves, the implications of those medications, and the monitoring and everything else that comes into play with that is probably far more effective. If you've got diabetes and you need, a review of your diabetes, seeing a GP for that can be effective, but seeing a diabetic nurse who's got specialism in that area, actually, that's probably going to be far more effective at understanding that element of your healthcare. Same with, for example, if you've suddenly injured your back and you're having difficulty with pain because of that after, lifting something, whilst seeing a GP can feel effective, actually seeing a first contact physiotherapist who can then also start your treatment there and then, assess you effectively, and recognize whether or not this is a minor musculoskeletal sprain or is this something more significant, and then refer you on to the GP if needed. That to me sounds so much more effectively. And the problem with seeing a GP first for a lot of that is then you're having multiple contacts to then see the right person afterwards. Again, it's wasting patient time. So using more resources, whereas actually, if you can be triaged or sent to the right service the first time around, whether that's through the clinicians or through signposting through reception teams, to me, that sounds more effective. And for a patient, it means their journey is a lot less complicated.
What do you say to those, notably in one particular newspaper, who've been campaigning to bring back face-to-face appointments and suggesting that patients are really losing out because of the lack of them?
As I said, I think there's always going to be some patients where those systems don't work as effectively for them. And we need to understand that. We need to know how to help them. And, that's not going to say that there are always going to be some people that do need that contact first with their GP. I think to the media outlets that seem to propose that that is the only way that you can deliver healthcare, well, let's be honest, they're stuck in the past and they need to get with it, to be honest.
And finally, how are you coping at the moment? We know that there's this huge wave, although we're hopeful that it's much less virulent, much less damaging to those who have it than previous waves. How's that affecting your practice?
I think across the entire country, many general practices are, to be honest, as close as breaking point as we've ever been. And when you count up the fact that we're still trying to deliver as effective healthcare as possible, trying to keep our patients as safe as possible, trying to deliver the world-leading vaccination program, and on top of that, doing everything else that's being asked of general practice, on top of Omicron itself leading to massive staff shortages because of isolation and factors that come into play. I think general practice is really struggling, and we've definitely felt that in our practice. Almost every day we've got another member of staff that's having to be away from isolation, and that clearly has an impact on what services we can deliver. And it's not just general practice, it's the other areas as well. Our district nursing team, who support us and do so much effective work, half of their staff are currently not available. Our local pharmacy has had to shut a couple of times because they just can't get a pharmacist in to dispense medications. It's all well and good me seeing a patient, but if they can't get the medications to help them, they're a bit stuck, aren't they? And I think recognizing that the healthcare service is genuinely struggling right now needs to be accepted across the board. How can we help? It'd be nice if we had some stronger leadership personally, and you can take that to whichever level you want. But I think ultimately it is very much a case of we all need to be a little bit more responsible, and we all need to be a little bit more understanding of the situation we're currently in, and work with each other to hopefully mean that we can all get through this.
Dr. Gandhi, thank you for seeing me.
No problem. Thank you very much.